Well, kidneys serve as a filter for your blood. They're also prone to disease, and right now thousands of Americans are waiting for a kidney transplant from either a living or deceased donor.
In this morning's Focus on Your Health, Teresa Snow explains how one man's gift made a life-saving difference.
Focus on Your Health is sponsored by MU Healthcare.
About 1/3 of the kidneys transplanted in the U.S. each year come from a living donor. Typically, they come from a family member or someone who knows the recipient. But that's not always the case. As an English teacher at Kirksville High School, Kyle Stirrup leads by example every day.
My worldview is just that if you're able to help somebody, you should.
He took that lesson far beyond the books when he decided to donate his kidney to a stranger. At any given time, about 110 people are waiting for a kidney transplant in mid-Missouri, but only 20 to 40 people will get one this year.
There's a big mismatch between supply and availability.
Dr. Mark Wakefield is the director of the renal transplant program at University of Missouri Healthcare, the only transplant program in mid-Missouri. He says donations like Kyle's can make all the difference for a person suffering from kidney failure.
The circumstances of a living donor transplant increase the likelihood that the kidney will work well and will last for a long time. So it's not only that you get a kidney sooner, you get a better kidney.
Little did Kyle know his kidney wouldn't be going far.
I was really excited. I brought to tears when I found out that it was going to Paul, somebody who lives here in the same town as me.
Paul Munoz was living with chronic kidney disease, receiving dialysis 3 days a week. He waited months for a new kidney, never dreaming it would come from his own community.
I thank them for saving my life. I hope we can be really good friends.
For Paul, it's meant a second chance at life. And these two strangers are now bonded forever by the gift of life. Joining me now is Dr. Mark Wakefield. He's director of the renal transplant program here at MU Healthcare. Now, besides St. Louis or Kansas City, Columbia, Missouri is the destination for transplants like this. How important is that?
That's correct. It's critically important for the citizens of rural Missouri. If you live more than 100 miles away from Columbia or any transplant center, you're less likely to get a kidney transplant.
And you've seen patients come from all parts of the state.
That's true, from the Boot Hill to northern Missouri.
What about the risk factors? What conditions might land someone on the transplant list?
Diabetes is the most common risk factor for development of kidney disease requiring a kidney transplant, and it's more prevalent in rural Missouri, and we provide access for transplant for those patients.
Kyle made the decision to be a donor, but many people will do something with their driver's license. Tell me about that.
So it's critically important to declare your intention to be an organ donor, and Missourians are very generous. 3/4 of us have agreed to be organ donors, and it's a lifesaver for many patients.
You've seen the wonderful results.
That is true.
Thank you very much, Dr. Mark Wakefield. And with Focus on Your Health, I'm Teresa Snow.
Focus on Your Health has been sponsored by MU Health.